Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And for this week's tip of the week, I want to cover how to discuss out-of-pocket fees with the patient. Now, this is a protocol that you're going to have to groove in at your office and do what's real to you, doctor, and the staff who are handling the fees. And it's something that you should actually practice so everybody's comfortable with it, and you should definitely have a discussion as to your protocol. But my advice, first of all, is doctor, it has to come from you. Just turning it over to the staff, the way is generally taught in dentistry, is not a good way to handle it. I believe it can actually set it up so the patient thinks that you're embarrassed about your fees or don't even know your fees or don't care. And I just don't think that's the proper approach to take. So first of all, you have to establish with the patient during the consultation, do they want to keep their teeth? That's the foundation for everything. Because if they have no interest in keeping their teeth, or you're doing implants or whatever, the procedure, you have to cover, do they have any value in what it is that you're trying to do? Because if there's no value in the end product, then it's just going to boil down to just how cheap can they get it, and that's where it starts to get uncomfortable and sometimes upsetting for everyone. So let's establish they do want to keep their teeth, and your treatment plan is going to help them keep their teeth. And then lay out for them what the fee is going to be. Now in my office, what we tried to do was estimate the insurance benefit on the low side. So if we thought the insurance was going to pay $500, we would tell the patient the insurance was going to cover $450 or something in that zone, because it's much easier to write a $50 refund check than it is to have my financial secretary get on the phone to collect $50 after you said the insurance was going to cover this. So that's one particular tip that is very helpful. Estimate on the low side. And then the patient has to understand that this is not like health insurance that just covers everything. There's an annual allowable maximum. There's fee guides and fee schedules. So I suggest you position it more like the rebate on a car. Sometimes when you go to buy a car, you get a rebate. And you're happy to get the rebate, but it doesn't change which car you're going to buy. It lowers your monthly payment a little bit, but it's not a big point to talk about the rebate. So you're going to have to come up with some sort of a position that you're comfortable with, but the patient has to understand that the insurance is not like health insurance, it's more like the rebate on a car. And finally, what I would do is I would look at the patient and say the bottom line here is you have to be prepared to pay for everything. Yes, the insurance should pay this. We've seen in situations, most situations they do, but then I don't know if there's something that they see that they don't like or whatever, then you have to be prepared to pay for everything. And I would just ask the patient, are you prepared to pay the balance? And if they aren't, then we have to discuss that. Otherwise, it's all about the insurance. So in our profession right now, I think it's become very easy and hard to end up just talking about the insurance and the benefits and this and that, and then there's a big debate over $20 copay, etc. So I like to just disarm the entire insurance discussion as much as possible, and that was my approach. So work out with your staff what's comfortable for you, and that's my tip of the week. If you like what you saw today, hit the subscribe button. There's lots more where this comes from.